And we are live. Welcome, welcome, everyone. Thank you so much for joining me on the medical terminology total retention system. We are going to be talking about uh, our medical terminology Q&A. Hold with me for a second here. I want to make sure I have my ears on because you won't be able to hear me if I don't. Thank you. So how's everyone doing out there in television land? I hope everyone's spared to Midland. How's the African family? And how are the children? Okay, just give me a moment here to get this hooked up. I gotta keep my ears on. I gotta hear what everybody's saying. And we're gonna be taking questions and answers today. And this is a section where we are just going over the whole summary of the class because we are looking for a minimum of 12 people to join us with this session next week. Okay. And we're going to get this ball game on the road, if you don't mind. Okay, 19 527 6060. Okay. We're just trying to dial up our other guests and get them in line. Okay, have to wait for the signal. They're asking me to enter my host pin, and I have to enter that, and it'll be just a second here. 4235 #. We're going to see if there are any messages for us. And we are going live now. Alafia, greetings and hotep. Welcome to Oracle Divination Network. We are also on the air with Omi Inca's production studio on YouTube channel. Thank you so very much. I want to welcome all of my friends. I want to say thank you for being my friend and allowing me to be myself. And for those newcomers out there, you can go down below and subscribe to my channel, to the Oracle Divination Network on Blog Talk, or you can subscribe to my blog. You can subscribe to Omi's production studio. Tell a friend. Also, bring a friend with you. We are going to be discussing the summary of questions and answers for our medical terminology retention system. And we would like for those to come in who have questions. Our class will be starting next week. We are looking for at least a minimum of 12 enrollees. Right now, we're just going through all of the details about the class so you can see exactly what we are going to be doing. All right, ladies and gentlemen, have a seat and please get yourself together. We're going to give you some signals here to call in. And in a minute, you can call in to my blog talk radio station. And we have a phone number for you. Just hold patient here. Let's get that number for you. All right. Okay, that number that you can call in on is 760-539-3247. You can call in on that number and ask your questions. We are going to be formalizing questions. We will stage some questions for you. Hold tight. Okay, and we're back, ladies and gentlemen. Now, let me give you that number so those of you who would like to be a part of our session, you can call in at 760-539-3247, and we'll be able to answer your questions. But we are going to be staging a few questions. And okay, now we got to get this. Everything's falling down. Okay, we're going to be staging a few questions, and we've got sunlight here. Oh my God, sunlight is just too much. All right, this might be a better way of doing this. Okay, we have a lot of sunlight here in Indy, and for some reason we can't get rid of it in this east side. Hold on. Okay, we've gotten rid of some of that sunlight. We'll be right back at you in a second. Hold tight. We are in the atmosphere and we do want to talk with you today. And we want to cover all of the questions we can think of. Okay. Now, let me do a little review for those of you who might not realize what is going on. For those of you who might just want to be able to see, let's see here. I'm going to be going back and forth with you. Let's see here. Okay, ladies and gentlemen, we have been talking to you about the foundations of health science and the retention program. Now, I like to say for the record, for those of you who were not here before, let me give you a little review. Why this is going to do like that. Let me give you a little review. We're going to be talking about the model curriculum of the Dean Bond Foundation of Health and Science, the effective method to teach basic human anatomical parts of the body. And we are going to be answering some questions for those of you who are going to call in. Let me just give you an overview. This online free textbook, free course teaches the, uh, the information about the anatomical body parts for each principal body part that includes the structure that associations with the medical terminology. Now, we're going to turn this around. Maybe I can see it a little bit better. See if it'll turn around for me, but it's not. Okay. Now, ladies and gentlemen, the materials that we are expecting you to have when you come to class, it works in conjunction with the natural learning process of the brain by converting the medical terminology and anatomical information into images of real and familiar objects that make it easy to learn and to remember. The materials, let's go over the materials that you would need, okay? All right. Foundation of Health Science consists of the following components that you would need for class. Now listen up. You might want to take notes during this session, but you don't necessarily have to take notes when you come to class unless you're instructed to do so. The 17 structural modules is what we're going to be working with. And we're going to use 16 of those, and one will be the question and answer. Students' quick start guide is what we're going to be providing for you. The facilitators administrator resources also. Your assignments, you definitely want to take note of this. At the active participants of the Foundation of Health and Science, you will be expected to do the following. Complete the pretest to establish a basis for measuring individual accomplishments. Next, view and carefully participate, i.e., in pronouncing the anatomical terms located on the body, parts, and the idiom and meaning along with the narrator, visualizing the auditory and its association in the video presentation that we're going to watch for each module. You'll have a video. Complete all association readings, assignment, and learning activities for each lesson. You're going to be asked to perform a final review of the basic human anatomy and association medical terminology. Complete the final test to assess foundations of health and science, knowledge, and understanding. Now, these are things that are expected of you, each one of you that enroll in the class. The objectives. Now, here are the objectives. On completion of foundations of health science, students will be able to do the following things. This is what you should be able to do. Identify the structure of the medical terminology and recognize word tools and word roots, prefixes, suffixes, combining forms. You should be able to do those things. And the following, understand that the meaning of most complex medical terms is derived from analysis of similar components of word parts. The next thing, understand the terminology and fundamental concepts of basic human anatomy. Then identify the structure of the human body, including anatomy, positions, body planes, and anatomical, the abdominal pelvic quadrants, regional subdivision, and body cavities through concepts of organs and system structure. Following that, identify the names and location of all major parts of each principal body system, including all 206 bones of the skeletal system and the structure of the eyes and the ears. Following, Understand the primary function of each principal body system. Next, complete a final test and achieve a percentage score of 80% or better. And remember, I told you, we're teaching to mastery. So everyone will have to obtain 80% to mastery. I said 85 before, but I hadn't looked at my notes. It's 80%. And we're going to be able to do that because we're using a retention program. Flow plan and the schedule. And here's how the flow plan goes. The assessment pretest. A multiple choice computer-based test can be administered by myself to you online. The online course participation in this assessment is very important. It will be used to determine pre-existing subject knowledge, assess instructions, effectiveness, and help in evaluating course knowledge and retention to evaluate whether or not you retain the information, the course knowledge. So that is why we're doing the testing. Recommended maximum time allotted is 1 hour that we're going to be in class. The lesson plans. Now listen up. And you'll get your chance to ask questions a little bit later on. I want you to listen now. And you can take notes if you want to. Dean Bond Total Retention Systems Foundation of Health Science consists of 16 modules, as I told you earlier, of the online video instruction. These are all online video instruction. Reading assignments and learning activities. Each teaches medical terminology or anatomy information. Individual modules each require 45 to 90 minutes of student participation. The following pages illustrates the suggested lesson plan for this course. Assessment and the final test. A multiple choice computer-based test can be administered by me, the instructor, upon completion of the coursework. Participants in this assessment is mandatory. You are mandated to participate. If not, you will not get a grade and you cannot pass the class. It will be used to determine participants' subject knowledge upon course completion and further assistance in further assist in assessing instructional effectiveness. So I will be able to determine what additional instructions you need. This will help me to guide you. Recommended maximum time allotted 2 to 3 hours. I said 1 hour, but we have 2 to 3 hours. Okay, remember this is online with videos. So a lot of this you are going to be self-guided on your own. And you're going to be instructed to follow along with the videotape and complete all the instructions of the videotape. Now, facilitators course instructions for the students. Okay, listen up, ladies and gentlemen. Okay, example. This course will be one of the most unusual courses you have ever experienced in your life, and relatively a shorter amount of time. You will learn the anatomical terms, and that is the director. Well, excuse me, this thing is doing it. Direction of location and related diseases through exploratory of the medical terminology, as well as the names and the location of all major parts of each principal body system, including their structure and basic function. To achieve maximum results, it is very important that you concentrate and eliminate all distractions occurring in the video presentation for each module. Do not take any notes. I want to say that again. During the classes, they're instructing you do not take any notes. When asked to do so by the narrator, participate pronouncing certain words in a whisper or silently to yourself. Now, you're going to have times when you're going to be asked to whisper the words silently to yourself, and they will tell you when it's appropriate to take notes. And when they ask you to do not take notes, do not take notes. This course is designed to increase your retention and knowledge. The visual association presented are used only to help you remember course content. Keep in mind, they are not intended to be intensive or in results, but only as a means to an end. When the class is over, what will matter most is that you will remember. Take a deep breath. Sit back and relax and pay close attention. You will learn and you will have fun. And that I promise you. I've given this test to many young ladies who asked to take the class over repeatedly times, and they oftentimes express how well they've enjoyed the class and how much they retain. Now, module instruction, module number 1, the Dean Bond Total Retention System, part 1 through 2. The purpose of the course is to provide you with understanding of the instructional design of medical terminology and a way to easily learn and remember the meanings of Greek and Latin. This is a Greek and Latin language that you're learning. I had indicated that it was a Latin language, but it is also Greek as well. So, because it's Greek and Latin elements of word parts, that combines to form thousands of complex medical terminology. These medical terminologies are read from the right to the left, and they're decoded through syllables. Complete module 1 and 1 reading assignments, importance of the learning activity, part 1 through 2. And that is the pretest, number 1. Number 2, reading assignments. Number 3, lesson-based quizzes and reviews we're going to have. Finally, the final test, the exam. Complete modules 1 through 2, reading assignments. Important definition parts 1 through 5. That will be the medical terminology, the elements, prefixes, root words, suffixes, word terminology, combining vowels, combining forms. These are some of the things we're going to be covering. You don't have to take note right now. Now, module 1, the medical terminology. View module 1 through 2, the video instructions to medical terminology. Complete medical modules 1 and 2, activity of learning, reading assignment, and practice quizzes. These are things you're going to be asked to do on your own. You will see them when you go online. I'm just going over them so you'll get an idea. And the view modules 2.2 video suffixes include like words. Let me give you an example that you'll be learning. Itis, oma, piña, ostomy, otomy, oasis, plasty, spasm, ostomy, Malaysia, path, oit, ectomy, meglia, ology, scope, lysis, algae, ologist, gram, rexus. Those are some of the suffixes that you're going to be learning. The complete module 2.2 learning activity and the reading assignments you must do and the practice quiz. Okay. View the modules 2 and 3, the video. You must view it and interact. The suffixes element, and here's an example of the suffixes. Dices, emesis, asthenia, area, trophy, astis, topi, acustis, protisis, aesthesia, crina, feel, dine, plex, plaglia, patisis. Those are some of the suffixes of the elements. And completing the module 2.3, you'll be learning activities, reading assignments, and the practice quiz. Okay? Viewing your modules 2 through 4, the prefix elements, and they are, and here's an example, a for a, dice, tro, pre, and, hemi, multi, quad, adi, hyper, peri, retro, bi, hypo, poly, ses, semi, Brady, inter, post, and sub. Now, I remember all of these suffixes and prefixes because I've used them in various different words. Okay? Now, the view modules 2.4 prefix element. Now you're learning the prefix, and they are, like I had indicated, let me give you that again. The prefixes is a, dice, intro, pre, and, hemi, multi, quad, auto, hyper, peri, retro, bi, hypo, poly, semi. Brady, inter, post, and sub. Complete modules 2.4 learning activities, reading assignment, and your practice quiz will be required of you. Now, modules 3, the anatomical terms and locations and the direction. You'll be learning the direction, anatomical terms. Okay, the complete modules 3.3, you have a reading assignment, introduction to the anatomy and physiology. You get an introduction. That's great. Okay, part 1 through 3. Now, complete modules 3.1 practice activities and modules 3.2, the model anatomical location. Where are they located? What part and what section? Is it an extremity, a lower extremity, or upper extremity? Okay. And here are some examples. The viewing of the modules 3.2, the anatomical location 1 through 4. Cranial, hypo, dorsal, alexia, septal, proximal, posterior, radial, caudal, distal, lateral, inguinal, superior, ventricle, renal, cubicle, inferior, anterior, chronica, polythial, ipi, and vascular. These are the anatomical locations. Okay, you'll go over these again. I just want to briefly review them. View models of 3.3 anatomical location. And that anatomical positions of the body planes. And they are sagittal, horizontal, lumbar, latex, hypochondria, regional, thoracic, pelvic, ventricle cavity, sagittal, frontal, umbilical, epigastric region, abdominal, dorsal cavity. Excuse me. And these are the abdominal pelvic quadrant that I just mentioned. The anatomical direction and location of the abdominal pelvic cavity would be hypochondriac region, epigastric region, abdominal thoracic cavity. And then the anatomical direction and location of the abdominal pelvic cavity are ventricle cavity, dorsal cavity. The complete module of 3.3, learning activities, you will have your reading assignment, practices, and your practice quiz. View the modules 3.4, the video, the medical elements associated with anatomical direction and location. See, the doctor has to know what part of the body, what part of the anatomical direction in the location of where this problem is. View the module 3.4, video medical elements associated with anatomical direction, and they are intra, infra, inter, infer, captive, cost, catra. Now, you'll learn all these terms. Complete modules 3.4, learning activities, reading assignment, and practice quiz. Now, module number 4 is the skeletal system. You'll be covering the skeletal system and complete modules 4.1, reading assignments, basic function, structures of the skeletal system, and parts 1 through 2. Then complete modules 1.1, 4.1 practice, and review the modules 4.2 video. There's a video you have to view. And the bones of the cranial, the face, the skull, part 1 through 4, and they are, I'm going to cover them. Part 1 named frontal, perennial, occipital, temporal, synosis, and then the ethmoid. Then you have part 3, zygomatic, lacriminal, nasal, vomer, contra. Then you have part 4, and that is malar, mandibular, the mandible. Now, complete modules 4.2, learning activity. And the learning activities consist of the reading assignment and the practice quiz. View modules 4.3 and the video, bones of the ear, the neck, the trunk, part 1 through 5. And they are, number 1, the malleus, the incus, the stapes, part 3 through 4, hyoid, coccyx, cervical, thoracic, lumbar, sacrum. And then finally, part 5, ribs, sternum. And these are parts of the skeletal system. Complete modules 4 through 3. Learn activities, reading assignment, and your practice quiz will be required. Viewing the modules for module 4.4 video, the bones of the upper and lower extremities 1 through 4. And they are the clavicle, the carpal, the sacropal, the meta, the metacarpals, the phalanges, which are the fingers, the hip, the tarsal, the femur of the leg, the metatarsal, the patella, and the tibia. One of my favorites the tibia in the arm here, and the fibia. Those were my favorite. And the complete module 4.4 learning activities, reading assignment, and the practice quiz. Now, the Dean Bond Foundation of Health Science module curriculum. Complete modules 4 through 5. Okay, what happened here? What happened there? Okay. Okay. Few modules and medical elements and the skeletal system. As I'm going to go over some of them: osti, hallux, author, pod, lumbo, diathysic, ortho, tarsal, pelvic, and shear. Let's see if okay. Okay. The modules 5.5 reading assignment and the basic function and structure of the muscular system is what we're going to cover in there too. And that's system part 1 through 2. Complete modules 5 through 1 practice. View the modules 5.2 video, how the muscles are named, part 1 through 4. Learn how muscles are named using the link method. And that is part 1 and 2, direction, the shape, the location, the site, the shape and origin and resection. Complete modules 5.2 learning activities, the practice quiz. And view modules 5.3 video, muscular names by action, flexor, levator, dorsiflexor, sphincter, extender, depressor, plantar flexor, tensor, abductor, suspender, inventor, rotor. These are anatomical direction. Complete modules 5.4 diseases and disorders of muscular system, and the reading and pre-quiz. Now, let's go down here to modules 5.5 medical elements associated with the muscular system, part 1 through 2. And they are bursal, spasm, fascia, tone, sin, lig, vas, tense. Complete modules 5.5 learning activities practice quiz. We go down here and it says module 6, the integumentary system. You're going to be learning about the integumentary system. Complete module 6.1 reading assignment, basic function of structures of the integumentary system. And that would be systems part 1 through 3, complete module 6.1 practice. View module 6.2 videos and the integumentary system part 1 through 4, and they are part 1 through 4, and they are dermat, hair, curtis, shift, epidermis, root, sweat glands, sebaceous gland, nail body, free edge, nail root, nail bed. And then the module 6.2 and the learning activities you're going to complete. Complete module 6.3, disease and disorders of the integumentary system, i.e. readings. And there's an assignment practice for that. View module 6.4, medical elements associated with the integumentary system, part 1 through 4. And they are, for example, cut, lip, pill, palo, trace, squam, onyx, fistula, adip, and chole. Module 7, the cardiovascular system. Complete module 7.1, reading assignment, functions and structures of the cardiovascular system, and system parts 1 through 3. Complete module 7.1 practice. View module 7.2 video, the cardiovascular system, the atrium, the anterior lobe, the ventricular, the capillaries, pulmon, the pulmon, ventral, aorta, vein, artery, ventral cavity. Complete module 7.2 learning activities and the practice quiz. And view module 7.3 video, how arteries and veins are named. Arteries near bones, vertebral, tibia, body regions, brachiocephaly, organs and supply, gastric, coronary, other arteries and veins, the cautery, the jugular, hepatic, and subclavicle. Complete module 7.3 learning activities and practice quiz. Complete module 7.4 disease and disorders of the cardiovascular system. And your reading is the assignment practice. View module 7.5 medical elements. Okay. So, the viewing of module 7.5, the medical elements associated with the cardiovascular, and these are pi, phlebotomy, okay, thrombosis, and lean. Complete module 7.5. Module number 8, the lymphatic system you're going to cover. Okay, I'm just going to breathe through these. And the lymphatic vessels and nodes, the cervix, axillary, the inguinal, the spleen, the thymus, the tonsils. And then you'll get ready to do your complete module 8.2 and learning your activities and your practice quiz. Module number 8.3, the disease and disorders of the lymphatic system. Your readings will include assignments and practice quiz. View modules 8.4, the elements of associated with the lymphatic system. And they are the lymph, the meglia, the loop, and the site. Complete modules 8.4 learning activities and the practice quiz. Module number 9. Module number 9, the respiratory system you'll cover. The complete module 9.1, readings assignment, basic functions of the structure of the respiratory system. And complete modules of 9.1 practice. View modules 9.2 video, respiratory system, and they include the nose, the bronchus, the mouth, the pharynx, the larynx. Complete modules 9.2 learning activities and practice quiz. And then you're going to go on to complete 9.3 disease disorders of the respiratory system. And that would include view modules 9.4 modules elements associated with respiratory system. And they are the rhino, the sinus, the pneumonia, the septic, the thoracic, the alveolar, the spur, and the purr. Pect, phenomena. Okay? Complete modules 9.4 learning activities and the practice quiz. Module number 10, the nervous system. Complete modules 10.1 reading assignment, functions, and structures of the nervous system. Part 1 and 2, complete modules 10.1 practice. View modules 10.2 video and the central nervous system. And they are brain and spinal cord, cerebellum, midbrain, spinal cord, white matter, cerebellum, pons, gray matter, thalamus, medulla, central cranial. Complete the modules 10.2 learning activities and the practice quiz. View modules 10.3 the peripheral nervous system. And they are the plexus, the somatic, the afferent, the sciatic, the infernin, and the sympathetic and the sympathetic. Complete modules 10.3 learning activities practice quiz and complete modules 10.4 disease and disorder of the nervous system readings and assignment practice. View modules 10.5 medical elements associated with the nervous system, and they are encephalio, epindac, thalamic, ganglia, plexus, reiki, dentra, neuro. Complete modules 10.5 learning activities and practice quiz. Modules 11, the sensory organ. Complete modules 11.1 reading assignment, basic functions and structures of the eye, part 1 through 2. Complete modules 11 through 11.1. View modules 11.2 video, the eyeball, optic nerve, posterior cavity, conjunctive, cornea, scleria, lens, and pupil. Complete modules 11.2 learning activities practice quiz. Complete modules 11.3 reading assignment, basic functions, structures, and ear. Complete modules 11.3 practice. View modules 11.4 video, the ear, external, outer ear, pinea, middle ear, tympanic cavity, stap, internal, inner ear, vestibule, auditory cranial, cochlear, malleus, semicircular cranial, incus. Complete modules 11.4 learning activities, practice and practice quiz. Complete modules 11.5 disease and disorder of the sensory organs, i.e. readings are assignment practice. View modules 11.16 medical elements associated with sensory organs. And they are lacrum, audio, arc, and myrin. Complete modules 11.6 and learning activities and practice quiz. Modules number 12, the endocrine system. Complete modules of 12.1, reading assignment, basic function of structures and endocrine system. Part 1 through 4, complete modules 12.1 practice. View modules 12.2 video glands of the endocrine system, and they include pituitary, ovary, pineal, testes, thyroid, pancreas, parathyroid, and adrenals. Complete modules 12.3, disease and disorder of the endocrine system, i.e. readings. Assignment practice. View modules 12, medical elements of associates with the endocrine system. And they are as follows: adrenal, hormone, thyroid, adrenal. Complete modules 12, learning activities, practice quiz. Module 13, the digestive system. Complete modules 13, reading assignment, basic function of structure of the digestive system. Complete modules 13.1 practice. View modules 13.2 video and the digestive system, parts of the small and large intestines. And they are alimentary canal, duodenum, colon, liver, esophagus, jejunum, sigmoid, cholecystitis, small intestines, rectum. Complete modules 13.2 learning activities, i.e. practice quiz. Complete modules 13 disease and disorders of the digestive system, readings, assignment practice. View modules 13.4 medical elements associated with digestive systems, and they are stoma, bile, bucca, omit, pito, peps, glyco, chill, and or. Complete modules 13.4 learning activities and practice quiz. Modules 14, the urinary system. Complete modules 14.4 reading assignments, basic function of structure of the urinary system. Complete modules 14.1 practice. View modules 14.2 video, the urinary system. Kidneys, urethra, urethra, and urethra. Complete modules 14.2 learning activities, i.e. practice quiz. Complete modules 14.3 disease and disorder of the urinary system, i.e. readings, assignment practice. View modules 14.4 medical elements associated with the urinary system. Nephro, urethra, and urethra. Complete modules 14.4 learning activities, practice quiz. Modules 15, the reproductive system. Complete modules 14.1 15.1, reading assignment, base function, and structure of the reproductive system. Parts 1 through 2, complete modules 15.1, practice. View modules 15.2, video, the male reproductive system. Testes, prostate gland, membranous urethra, scrotum, epididymis, spongy, urethra, penis, ductus, deferens, urethral, orifice, gland, penis, ejaculatory duct, prostatic, urethra, seminal vesicle, biborithial gland. View modular 15.3 videos and female reproductive system. Ovaries, urethran tube, urethras, cervix. Complete modules 15.3, learning activities, i.e. practice quiz. Complete modules 15.4, disease and disorders of the reproductive system, i.e. readings and assignment practice. View modules 15.5, medical elements associated with reproductive systems, and they are ortho, gravidis, salpingo, lac, gyne, umbilium, copy, mammy, ovary, upper, metro, on ertol. Complete module 15.5, learning activities, practice quiz. Module 16, medical terminology. View module 16.1, video, universal elements, and they are sternal, vesicular, rugament, telly, splenetic, iso, somato, benign, anti, miglian, tracho, Milens, Michael, Andextria, Hypono, Onyx, Plastia, La Paire, Sclere. Complete Module 16, learning activities, reading assignments, practice quiz. Video Module 16.2, video universal elements, and they are septic, sedate, parrot, micro, skirt, circa, Jimin, phoba, antra, radic, grade in, plaque, radi, calc, pro. Alveolio, metabolic, labby, mechano. View the Module 16 universal elements, and they are dynamic, neural, ab, macro, traumatic, therm, anti, ambia, sim, x, crico. Strict, ramus, pure, male. Turban, pan, proli, glomy. View the module 16.4 universal elements, and they are Sami, Amp, Fia, Hector, Med, Pharmac, Class, Home, Eric, Vert, Duck, Sta, Per, EU, Fis, Vom, Blast, Ambi, Ger, Span, Chin, Duck. Complete Module 16 learning activity, reading activities, assignments, and practice quiz. Now, view Module 16.5, Universal Elements, pharynge, olfact, pito, helo, cholia, histo, osmos, phagli, lumbo, tarso. Complete Module 16.5, learning activity, reading assignment, practice quiz. Complete Module 16.6, reading assignment, medical terminology using the description of disease. Complete Module 16.7, reading assignment, medical term used in operative procedures. Module 17, conclusion. And in conclusion, view Module 17.1 video, the Dean Von Total Retention System, parts 1 through 2. Congratulations on the completing Foundation of Health Science, a Dean Von Total Retention System, preparing for the final test. Complete the final test. Now, this is where you would be completing the final test, ladies and gentlemen, and preparing. Now, we're going to stop here, take a little break, and we're going to come back to this session and let's see here. The sample group review questions. We're going to stop and then talk a little bit about stretching your arms, taking a break, and getting back in tune for what is to come. We want to make sure that you understand all of this stuff. We don't really care that you understand now because you wouldn't understand all of these things, but I gave you the outline of the 17 modules that you're going to cover. Now, are there any questions? And if there are, you can phone in your questions and you can get those questions to me and we will go over them upon doing our questions and answers. But lock this phone number in. This is the number you're going to dial into, and it's 760-539-3247. That is a number that you can call in with your questions. Right now, we're taking a little break, and in between our sessions, I want you to know that these are some of the things that you're going to cover in the class. We talked about the endocrine system, the skeleton system, the nervous system. We talked about, what else we talked about? We talked about when we went through the male productive system and the female productive system. And each one of them, you're going to be able to view a videotape on, and you'll have hands-on experience without taking notes while you're online. I won't be there to guide you. These programs will be all uploaded online for you. And for those first 12 people that sign up, they will be able to sign up immediately. Now, I don't know the maximum number that can go in the classroom right now. We're working on that now. And I know I only want to put a minimum of 12 people, and we'll find out if we can go further than that. This will be a free class where you'll independently work on your own, and you'll follow the prompts, and the prompts will guide you through all of the material. It will even have a recording artist there to enunciate and pronounce the correct pronunciation of the words so you'll have the words right. Now, one of the things you want to understand is that we are doing this to get more people ready for the workforce. There is a big need for medical, holistic health, and, well, I guess you would say medical students in areas such as phlebotomy, radiology, also in the area of occupational therapy, physical therapy, assistant, as well as respiratory technician, respiratory therapist, occupational therapist. So they need to have these foundational courses. It will open up doors for you guys to get jobs and get a better understanding of jobs. Now, let me go over the questions and answers because I know you're dying to ask questions. Hold tight. And these are the samples of the group review questions. And if you're out there listening, listen closely because these may be some of the questions you want to ask. The following questions are provided to reflect the range of material covered throughout Foundations of Health Science and as an additional resource for the instructor, i.e., for the course planning. And these are some questions that you might have, and the implementation grant proposal. Okay? Now, these particular questions you might have. What are the basic word parts of elements that form most medical terms? Okay? Might ask that question. And the answer is the three basic word parts of elements that form most medical terms are the prefix, root, and suffix. Don't forget that. The prefix, root, and suffix. Question number 2. In medical terminology, what primary purpose does the combining vowel serve? The answer to that question is the combining vowels is primarily used between two or more elements of a medical term to make the terms easier to pronounce. Our next question, explain the meaning of combining forms and provide an example. I will do that for you. A combining form is a word root, and with an added combining vowel, generally used to when combining the root, of course, and another element. For example, gastro, the root is the gastro. And then you would combine that with an O, gastro, and plus the O, combining the vowel equals gastro, combining form. Okay? Our next question, name the branch of medicine that is the study of tissue, or more specifically, that structure, composition, and function of normal cells and tissue. Your answer is the branch of medicine associated with the study of tissue is including its structure, composition, and function is histology. Next question, which two suffixes or medical term endings are generally used to designate medical specialties? And your answer is the two endings that dominate terms designating medical specialties are ology, study of science of, and itry, healing, treatments of diseases. Next question. What is used as a position of reference to aid in understanding the various regions of the human body and the location of anatomical parts? The answer is the anatomical position is the standard body position of reference and basis for the description used in understanding anatomical locations. Next question. What assumptions are made about the anatomical position? The answer is the anatomical position assumes the human body is standing erect, facing forward. That's what is assumed. With arms hanging at the sides and palms facing forward. Next question. With regards to anatomical direction, which terms are used to designate front and back? And the answer is the term anterior and ventricle are used to designate front or in the front of. Posterior and dorsal designates back or in the back of. Dorsal in the back. The front part is the ventricle, interior. Question. Identify the body cavities of the human body. How do we do that? And the answer is the human body consists of the pelvic, abdominal, thoracic, abdominal, pelvic, the dorsal, and ventricle cavity. Identify the principal functions of the skeletal system, and they are, please remember these. The principal function of the skeletal systems are to provide a framework of the support, protect vital parts of the body within its structure, provide the body with motion via tendons and muscles, serve as a minimal source and storage, produce red and certain white blood cells in the red marrow of the bone. How many bones are in the human body? And don't forget this one. The adult skeleton system consists of 206 bones and their associated cartilages and joints. Next question. Identify the way by which muscles are named. And the answer is muscles are named by direction, location, size, number, shape, origin, and in sections and actions. Next question. What are the three layers of the skin? And the answer is the skin consists of three layers, including the epidermis, the thin outer layer, the dermis, the thick inner layer, and the subcutaneous tissue, the bottom layer. Next question. The nervous system is divided into how many major divisions? What are they? Which system contains the brain and spinal cord? The answer. The nervous system is made up of two major divisions, and the central nervous system is the central nervous system and the peripheral nervous system. The central nervous system is comprised of brain and spinal cord. Next question. Which layer of the eyeball system to receive and translate light energy into the nerves, impulse, and relay visual information to the brain through the optic nerve? And the answer is the inner layer of the retina is responsible for receiving and translating light energy and relaying information to the brain through the optic nerve. Our next question. Identify the principal function and regions of the ear. And our answer is the principal function of the ear are two. Number one, receive and conduct sound to the audio nervous system for transmittal to the brain. Next, maintain equilibrium for the human body. The principal region of the ear are the external or the outer ear and the middle ear and the inner ear. Next question. What is the aorta and its principal division? The aorta is the largest artery. Most of the major arteries in the human body offer from its four principal divisions. The ascending aorta, the arch of the aorta, the thoracic aorta, the abdominal aorta. The next question, the lymphatic system is composed of which primary organs? And they are, the lymphatic system is made up of three primary organs, and they are the tonsils, the thymus, and the spleen. Next question. Identify the organs of the urinary system. What is the primary function of each? Answer is, the urinary system consists of the kidneys, which produce and drains urine, and the urethra, which aids the passage of urine from the kidneys to the bladder. The urinary system and the bladder, which stores and releases urine, and urethra, which aids the exit of the urine from the human body. Next question. What is the alimentary canal? What is it made up of? The answer is the alimentary canal is a continuous tubular canal of the digestive system through which food passes. It runs through the body, extending from the mouth to the anus, and includes the mouth, pharynx, and esophagus, the stomach, small and large intestines, and the anus. Next question. Which accessory gland of the male reproductive system secretes alkaline fluid to neutralizing urine into the urethra to aid in the movement of sperm? Oh, okay, here's that answer. The seminal vasculus and the prostate gland secrete neutralizing alkaline fluids to aid in the movement of sperm. Next question. The vulva, collectively the external female genital, includes what principal part? That principal part is the external female genitalia, or the vulva contains the clitoris, labium minor, and the labia major. Next question. Identify the major categories under which operative procedures are classified. Answer, within the body system and major organs of those body systems, operative procedures are classified under the following major categories, and they are as follows. The incision, endoscopy, manipulation, excision, repair, amputation, destruction, instruction, and suture. And those are the questions and answers. Now, if you have questions and answers that you would like to if you have questions and answers that you would like to formalize, I will ask you to please get those questions and answers together because we are still waiting for you to give us the information, and we're online now. And our number is 760-539-3247. You can call into the line now, and we're going to take a short break. Hold tight. Okay. We're trying to get a little bit more light in here. Welcome back, everyone. Thank you so very much for joining me on this particular occasion. And for those of you who are ready to start your training to get into the medical profession, and we're talking about medical coding, and this is the home health coding aspect that we're looking at the specialty. We have just finished doing the outline, the overview of what consists in our total retention class. This class is free of charge. It is my service that I'm giving back to the community to get those men and women engaged in learning about medical terminology. Some of you may have thought you could never do medical terminology because your science aptitude wasn't that good. But here you see that this is going to be a fun class. There's going to be hands-on. We're reviewing the audio tape. I'm listening to the enunciation, reviewing the videotape. There will be no taking notes unless the instruction gives you the requirement to take note. There will be no need if you're learning through word association. So you're going to be able to play games. You're going to have activities with flashcards. And this will be all online. Now, mind you now, when I taught the class, it was in a core host class where we met in person. They've just recently put it online because they wanted to be accessible for more people. And this will guarantee, if you follow the procedures, that you will retain 80% of this information. You will teach yourself and go back and forth with flashcards. then you will take practice quizzes. And during those practice quizzes, you want to keep track of all your scores because at the end, you want to maintain an 80% score. So you can walk away with retention of 80% of memorization. So when you go back out to look for a job, you don't suddenly lose it and forget it. It'll be maintained in your subconscious mind. Remember, this has all been based on science so that it is designed for total retention. And then we were also going to be covering the anatomy and physiology in the class. He has a class that is functional, and that functional covers all of the anatomy and physiology so that you can bridge these skills right into the subject of anatomy and physiology. We will not be teaching that up front. That will be a separate class. But for those of you who hang with me now, you can run with me later because next week is when we're going to actually start the class. I thought we'd give everybody some time to think it over, to listen to what's involved and get an idea. And then next week, I will announce the date and time that we will officially start the class. Now, there are a lot of people out there that can use this knowledge. And if they don't have a foundation for science, you will soon learn to have a foundation because most people don't aspire to do well in the science classes. Science was my favorite subject. And while in school, I did very well in science. And I also went on to take some science classes in college, the biology 1 and 2, after taking and then taking chemistry, anatomy, pathology, and physiology. I took all of those classes because I was preparing to become an occupational therapist, so they were required. Now, I will say this much. It's very vital that you get a grip on handling the medical terminology because everything starts with medical terminology. Everything. You will begin to understand that medical terminology is the foundation of all the medical classes. And you will see that you need medical terminology in order to expound upon doing work in radiology, doing work in occupational therapy, respiratory technician, being an occupational technician or assistant, and a CNN. If you're going for your LPN or RN and BSN, you are going to have medical terminology. That is the first foundational class. Then after that is the anatomy and physiology required course. And those courses are required to give you a more in-depth understanding of what is involved in the thoracic cavity. How do we look at the ear, nose, and throat? Now, the actual area of coding that I told you that we're going to be looking at is a specialty code. So you're going to be able to go from this to go in to take the anatomy and physiology. And upon completing that, we're going to do a brief introduction on ICD-10-CM. So you're going to learn how to code. Now, I know you probably heard, well, don't they have software out there where you can just look up the code? But you still need to know the old traditional way of manually flipping through your index, going to your categories, finding the actual diagnosis and the procedure, and looking it up. Now, in your home health book, you don't have a CPT book. You're only using your home health, your complete home health, and everything is in that book. Whereas in the traditional coding that's not specialized, you have to have a CPT coding, a DRG, and the regular ICD-10 booklet. But we're working on the specialty. So you'll only have to purchase the home health complete home health ICD-9 book, which is over $200. And it's worth it because it's going to be your meal ticket, your ticket into employment. And you will be able to see that through having these courses on your resume will mean the world to you and give you an opportunity to start your work search out on a good path. The IT positions are going to be in demand. Anything in the allied health profession is going to be in demand. And especially when you can take a job and do remote work from your home, that is the best thing that you can do for yourself and your family, to set up your office and work remotely from your home. Now, of course, I'm not telling you that you can start off that way, excuse me. I'm telling you that you have to get some work experience under your belt, and you have to sit in someone's office for a minimum of 5 years to get this experience, and then you can look towards going remotely, working from home. But don't think that you can go skipping in to your home to do remote work when you first start. That would be a little bit unusual for somebody to hire you right into a remote job without ever giving you a foundation for working in the office. But once again, let me also say that I've been in this field for over 20 years. I have dabbled in it as an adjunct to teach the classes at the junior college because I had over 30 hours in the actual area of the medical field. I had over 30 hours, over 60 hours from the medical terminology from the 2-year program with the registered health information technician training program that I completed while at College of DuPage. So I had the foundational courses. I just hadn't sit for my exam. And I was also in internship. And a lot of you are going to want to go in and possibly do an internship. If you don't continue with your training, which I hope you do, that you go and get your certificate program, and upon getting the certificate program, then you do the review for the actual certification. The certificate program is not the license. It's just to say that you have the foundation in home health care and that you can process a medical claim and paying a doctor for the procedures. But you want to go further and get your license and become certified. So all of this that I'm telling you is to get you prepared for the review and to make you understand that it's going to take a commitment on your part. Uh-oh. Sometimes this thing. Okay, we got it. Okay. Okay. Hold tight, ladies and gentlemen. We're going to go to commercial. Okay, that was a brief commercial, ladies and gentlemen. Thank you so much for joining me today. As we go through this segment, we are explaining the details of the class, what is expected of you. We've outlined that information, what you have to do in order to attend this class, and some of the practice quizzes that you'll be doing while online. And you must have a sturdy ability to stay with it, because if you start beginning with us and end with us, then you will get some type of certificate of completion. But if you do not stay the course, you will not be allowed to get a certificate. Our phone lines are now open and you can call in with your questions, and our number is, if you want to call in with more questions, we've covered some questions. Our number is 760-539-3247. Call in and definitely state your questions, because this is the time to ask questions. And we want to make sure people thoroughly understand. That's why we're not running off too quick with this class. We ran up a little impromptu with the other class, and we didn't get the numbers that we were looking for, because a lot of people, they don't want to commit. But it's going to take some commitment on your part to be in this class, to do the work, and to complete it. Stay tuned. We're going to commercial. And we are back. Welcome back, everyone. Thank you so much for joining us. And you have got your Omi Inca. I am your Empress. I'm here to serve you. I am your Maliwa. I'm your Omi. I am your teacher. Thank you so much for being our friend and joining us today. And if you haven't already, go down below and subscribe to my channel. And if you can bring a friend and tell a friend about my station and sign up. It doesn't cost you anything. And then you can also hang with us when we have our celebration in the Blog Talk Room under Oracle Divination Network. That's right, ladies and gentlemen. We're going to be celebrating our 10th anniversary of being on the air. And we would like for you to come and fellowship with us, and we can give you the right hand of fellowship, and you can be a part of the network. The network is the Oracle Divination, and we are a paranormal group where we deal with paranormal issues, and we talk with the family, bring the family in on this. This is a family affair, and we definitely focus in on dreams and oracle readings and fetish issues and dealing with High John the Conqueror. And we are going to be doing more oracle addressing because we are Kemetic. We want to make sure you understand that Kemetic people do everything Kemetic style. We adhere to looking at the oracles before we make decisions on things. Now, I've taught you about how to become your own oracle reader, and I will tell you that it's important to stay connected to your ancestors and stay connected to the stars, and realizing that in the Kemetic teaching that everything was done with the stars, the astrological signs. Whatever is above is below. And we feature those fetish things, and we talk about those paranormal things on our radio show. And today we happen to be addressing the allied health profession to open up opportunity for those moms that are sitting at home who would like to get out and get a job and who would like to do remote work. And I confess it's going to be a process. It's not just going to happen overnight where you work from your home. unless you've already worked in the profession and have 5 years of experience behind you, you're going to have to put that time in. But for those of you who have worked in the profession and have a couple of years behind you, you might be able to get away with taking your years of experience to some local insurance company, some outpatient clinic, urgent center, or some home health center or hospice center, and going in and asking if you can do some of their backlog work and work on the inside and show them what you're capable of doing, and then go back and say, I can work remotely from my home. Then show them the skills that you have had, especially the courses that you've taken in the allied health profession. Allied health is going to be in the 20th century, it's going to be more than in demand. They're going to have a shortage where they cannot fill enough of the position. But with your experience and having a head start in the allied health profession of medical term, anatomy, and physiology, you will be well on your way to go and be prepared to find a job. We want you to understand it doesn't stop here with the medical term. You're going to have to go on and take the anatomy and the physiology so you can learn the parts of the body and how they operate in the skeletal system. And remember, we said there were 206 bones of the body. And we went over the skeleton system. We talked about the zygomatic bone. We talked about the frontal. We talked about the femur and the tibia and fibia in our arms and our knees. We talked about these bones in our lower extremities and our upper extremity. These are all the things you're going to be expected to know. You're going to have a grand time in the classroom. You're going to get so many accolades to reassure you that you can retain this information. And learning should be fun. It should be a gratification, immediate gratification, so that you feel good about the process of learning and you'll go on to advance yourself to other levels of the medical field. Occupational therapy is a great area where you can work in the classroom with children as well as in a hospital. And I was initially going for occupational therapy, and I switched over to respiratory therapy and worked in that field for 5 years. Respiratory is a little hard on the feet, a lot of patient contact, and it does not deal with charting, except for when you give treatments, you chart. But medical records deal with charting, working with the patient's chart and pulling the patient's chart for those medical claims to be paid, making sure you know what the diagnosis is and the DRG regulations. There's a lot of compliance in medical coding. Is this company complying with the regulation? When you go into home health care, you can specialize in compliance. You can specialize in OASIS that deals with Medicare. You can even specialize in the home health care that deals with the nursing home or the hospice, where the patients go home to complete the rest of their days on this earth while they slowly sit with their families and not have to be in the hospital. These are all the areas that are specialty, and you can prepare for these areas. Now, I've given you the foundation of what the course is all about. Some of you should be able to make some decisions and determine, is this for me? Should I enroll in this class? And some of you should be able to do that. Now, hold tight. All right, ladies and gentlemen, we're having a little party in here, taking a little break, taking a breather from the classroom lesson. I hope you've got the information on the classroom. And if you have not heard the information, go back and rewind the tape on demand, and you can listen to it on my YouTube channel, or you can listen to it on Blog Talk on Oracle Divination Network. And ladies and gentlemen, it's been a real blast to be in here to talk to you about being a medical person. I enjoy teaching in the medical field, and I thought I would give something back to society. I've been so fortunate that I've had training in histology in the hospital that was given to me for free, as well as respiratory therapy. And I did have to pay for I didn't even have to pay for the medical records because I was given a scholarship to go through the 2-year program at College of DuPage. I was granted a scholarship after writing a paper in order to express to 3M what they could do with the fish cart machine. Yes, you can be granted a scholarship to go to school because they're always looking for medical coders and transcriptionists and medical coders who also do tumor registry, who track all the cancer patients. There is a lot of avenues. If you win for the medical records, you can branch out into tumor registry, you can branch out into transcriptionist work, and branch out into extracting the records for attorney's office for malpractice suits. You can get involved in a number of things through going through the medical records curriculum for the 2-year program. Now, if you don't choose to go for the 2-year and you just want to get a certificate in the coding, you can get a certificate, a specialty certificate for coding specialist, and that's a 1-year program if you wanted to go the traditional route. But after taking these classes, you can prepare yourself through a review after taking your home health specialty, whichever one you're going to specialize in, and your anatomy and physiology and chemistry, and taking the coding class. Then you can be prepared to go in and challenge the exam. If you pass it, you don't have to have a degree. You just have to pass it. So isn't that grand that you don't have to go back and get a 2-year associate? You can take these courses that you're taking under continuing education and prepare yourself for the review, and then go and challenge the test. And if you pass the test, if you do it through the home health, complete home health, then you can get an endorsement in the specialty areas. If you don't want to go to the specialty area and you just want to code all general codes, you can get the CPC through HAHIMA. And then there's also AAPC who gives a CPC, and HAHIMA gives a different endorsement. These are the agencies that endorse for the licensing outside of the home health. The home health has like an I think it's the HCS. I can't remember the acronyms on that. But you definitely want to stay abreast, and you want to stay tuned to what we're doing. So make sure you don't miss any of the classes, or you go back and review the tapes, and they will be on demand so you can review the tapes. I want to thank those people on my blog talk for staying with me and being my friend and becoming a member. If you have not become a member yet, it's free to become a member of Blog Talk. You can sign up and you can be my friend and become a member for free. And then you can listen in to other radio stations as well. Now for YouTube, I'm urging you to go down below and ring that bell. That bell will tell you when I'm on the air. And you can also go down and become a subscriber and leave a comment about the class. Leave a comment about any of my classes. There are other tapes that I have out there and videos on demand. Go and listen to me in other avenues. I'm not just talking about classroom teaching. I'm doing a lot of talking in other areas. So go and sign up and become a friend, and become more than a friend. Become a subscriber. You'll be glad you did. Go on and follow the leader. You'll be glad you did. I'm not charging you anything. I'm not asking for any money out your pocket. So at least you can do is become a subscriber. And why not? You see that you can benefit from being a subscriber, and you'll see that you'll be glad you did. Hold tight.
When you don't go to Geico.com, car insurance can be hard, like early 90s heavy metal hard. Geico makes it easy. You can review and update your policy or report a claim on Geico.com or the Geico mobile app. Shouldn't we all have a little less stress in our lives? I'm not even upset about anything. And I don't want to leave you lonely. You gotta make me change my mind. Baby, just give me one reason. Oh, give me just one reason why. Baby, just give me one reason. Oh, give me just one reason why I should stay. And I told you that I love you, and there ain't no more to say.
All right, now, ladies and gentlemen, now you know.
I interrupt the airways.
Now you know that's my favorite song, and I just had to play it. I had to play it, and don't ask me why, but that's one of my theme songs. Now, ladies and gentlemen, for those of you who have missed the whole segment, I have asked that you call in, and I have encouraged you to call in, and you will have to view this tape from on demand. And we are going to be checking out of here saying, please do go back and view the tape on demand and then call in with your questions next week. We will be on again this weekend, so you might be able to catch us on Saturday and be able to ask those questions. But next week, we're going to announce the date that we're going to actually start the class, and we're looking for a minimum of 12 people to get you up and running online independently. You can take the course at your own pace and finish the class with 80% retention in order to receive a certificate. Now, I've given you the best that I have to give. I'm giving you the best that I have to give. I'm giving you the best that I have to give, and I'm asking you to take the next step. Now, I took the first step. You take the next step. Attend one of the review sessions, and we'll be reviewing up until next Wednesday. After next Wednesday, we're going to announce the date for the class to start. By then, you should have thought it over, looked it over, had a chance to look at your schedule, see how you can fit this in, and then join us in our escapades to advance our knowledge. Now, Project 2019 has been one of the people that has pushed me to push for more education and for African Americans completing credentials and getting certified and licensed. And that is one of the reasons why I'm pushing this class today. Project 2019 will be celebrating one of their outstanding celebrations for their conference coming up in April. That organization, which I was a part of and still am a part of, because Chuck Sanford has indicated that African Americans will have to come up to par by getting credentials and getting degrees. Now, if you can't get credentials or degrees, then get certificates and certifications and endorsement so you can find a job and advance yourself and get off of the lower socioeconomic level and increase your net worth, because that's what we're doing these days, advancing ourselves. If we could do it in the music industry, by all means do it. If I can put out some CDs and can put out some spoken word artistry, you better believe I'm going to do it to increase my net worth. Because somebody out there wants you to be poor and outdoors, and they don't want you to increase your net worth. But this is an effort to give Black folks a chance to learn a skill and a trade and to increase their net worth. And if you don't go along with me, and then you complaining about there are no jobs and you don't have the skills, and somebody's trying to offer you an opportunity, this is the one class you can pass with 80% and feel good about it. It gives you a leg up. So as I'm giving you this leg up, you need to take that opportunity and take it by force, sisters and brothers, and don't just sit there and say, well, I don't think I can do it. If you can take your own time and it's self-paced and you can go online to complete these assignments, you're going to feel more than happy about your success, because it's guaranteeing you that you can accomplish 80% retention. Do you know what that means? You can retain these Latin and Greek terms and look very impotent when you're talking to the doctor and decoding and encoding these large words that are Latin and Greek and be able to decipher how to spell them, that's even more impressive. So why not take this lead from Omi and get these credentials? If I can get these credentials, anybody can. And when you get these credentials, don't just stop there. Go for the anatomy and physiology, and then go and sit for one of these endorsements, like I told you, the hospice endorsement, the home health endorsement, the compliance endorsement, and looking at the fact that you can become credentialed with the certificate, and then go on to do the review, and then preparing yourself for ICD-10 CM so you can do the review. And there's a big conference coming up this summer during the month, I think, of July and August, I think it is. And then you can prepare to go to that conference, and you can be credentialed before you go there. And then you'll be one of the guys. You can be one of the posse, the people that have their credential. You can rub shoulders with them. You're upping the ante. You're upping your skills now. So why can't you take that first step and taking the class? It'll help you. You'll see. Go on. Take 5. We're taking commercial. All right, ladies and gentlemen, you have had your opportunity to formalize your questions, and I'm going to check our phone lines one more time. Our phone lines is 760-539-3247. If you have any questions for the OMI, you can formalize them now before we leave these airways. You can call in with your questions about this class that is preparing to get on its way. We just did our review today, and if you missed it, men and women, go on to the Blog Talk Network, our Oracle Divination Network, and review the session, or you can go on YouTube and you can hear it there. And I want to thank you for letting me be myself today, again in the boardroom. Thank you so much for being able to come here, and I am unmolested and I can do my job today. And we're going to get out of here this evening, ladies and gentlemen. You've been a blast to work with. Thank you so much. Oh, Dabo and Baba Booey to y'all. All right now. Thank you so much for joining us. And you've been listening to Maddie Harvey's Baby Sister here on Oracle Divination Network, and also tuning out from Omi's production studio. Go out and become a friend and become a subscriber. Also, leave me a message, and do share this with a friend. And let a friend know that we are starting our classes next week. If they would like to be a part of it, share this with a friend. And do come and be a part of our class. We're going to have a blast while you're on time online doing your self-paced class, and you'll be able to report to us in a group, and we can spend our time looking at how much we've retained and how we're able to use this in our existing jobs or a future job. But once again, I'd like to urge you to come back and be with us this Saturday. We'll be on again this Saturday at around 3:30, 4. It depends on what we've got going that day. But nevertheless, do join us. And you have been listening to Omi Inca's production studio. Yes, on YouTube. You can subscribe, YouTube. You can also be a friend. And you to ring that bell so that you know when I'm on again, and be a part of our session. And we've got to get out of here because we've got some more things to do today. And this is not the only thing that we do. We got to get out of here. Stay tuned. Goodbye. Oh, double.
Thank you for using Blog Talk Radio. Goodbye.
And to all you YouTubers out there, go down and sign up and make sure you become a subscriber and ring my bell. Leave a comment about my classes. Support me in what we're doing. We're trying to bring about an opportunity for minorities to gain knowledge while online. Get some education, advance yourself. We're coming up on over 400 years that we have been out of slavery. It is time now. So I'll see you around Saturday between 3:30 and 4 o'clock on this channel. You don't want to miss it. We are getting ready to go into our medical terminology, our total retention program, where you can retain 80% of the information. It was created that way. It was designed that way so you can master the class and don't feel bad about the fact that you are failing. You won't fail in this class. We just won't let you. It's an opportunity for you to get 80% of scoring on all your quizzes. Now try it. Go ahead on.